I think we're back live again. Takes some time. I think we're back live again. Takes some time.
Yes, I think we are live now.
Okay, so I think just to say I'm very grateful for your contribution. I would like to say you have many qualifications. You're a fellow in dementia, addiction. I think you were a specialist in cognitive behavior therapy. You're working here for us, for the Global Psychiatric Association, as head of the scientific committee. And you've been very much involved in managing the conference. So we're really looking forward to your talk, Music Therapy in Dementia and the Practical Approach.
Okay, thanks, Rainer. Okay, music therapy in dementia is a rather known strategy, but it's not very widely used in practice. Now, in this presentation, we have to talk about what's the real problem in dementia daily care, how can music therapy help, and how can we focus music therapy as a neurobiological intervention, as a social work intervention, an occupational intervention, and what options do we have to treat our patients? Of course, planning a musical intervention, it's a very thorough process, it's a very complex process, and I intend to describe you a brief clinical case regarding the practical use of music therapy. Of course, in popular culture, music therapy has had its place. I hope many of you have seen this movie. This movie is called Coco, a movie from Disney and Pixar. And this is an example I want to bring because in this movie, there is a scene where the little kid that you are seeing here sings a song to his grandmother. His grandmother, it's actually has a very difficult functioning in the family, starts singing and talking regarding the emotions and memories that this specific piece that was being sung to her brought to her. And this is the core concept of musical therapy in dementia patients, to help them through music to orient themselves in time and space, to help them to use their current functioning memories. Okay? Now, when we talk about the real problem in daily care of the demented patient, what's the problem? Is it the pathophysiological changes? Yes, perhaps. That's actually the core of the current investigation in dementia, in the different types of dementia. The pathophysiological changes are quite thoroughly described. But is it a daily healthcare problem? Meaning, is this something that can bring a patient to your consult? Is it the selection of a pharmacological agent? Perhaps. It's a very important aspect of dementia healthcare for the clinician. Selecting a proper pharmacological regimen, it's a paramount challenge in dementia healthcare. But is it the speed and rate of decline? Perhaps. But there are no current ways to predict what will be the speed and rate of decline of patient, aside from the controls that you can do in your consult. But the answer, finally, in the day-to-day basis is no. None of these are the problems in the care of the patient with dementia. The real problem is the challenges in the daily interaction between the patient and his or her caregiver, meaning that if there is a patient with dementia in your consult, specifically in your specialized consult, it's because the caregiver, whoever it is, will bring the patient for the daily challenges, the behavioral disturbances, the disorganized speech, the disorientation of the patient. Okay, then there are many ways in which can actually treat these problems, this actual problem in the day-to-day basis. But how can music therapy help? As I told you, music therapy can work as a neurobiological intervention, but it's a very complex model of treatment. It's not my intention in this presentation to give you a thorough exposition about music therapy because of its complexity and multiple uses in day-to-day healthcare, mental healthcare. It would be out of the scope of this presentation. But it's important for you to know that it also doubles as a social work intervention and as an occupational therapy intervention. Now, how can this be? Okay. Alzheimer's disease does not typically involve areas that relate to implicit musical memory functions. This is important because in practice, what you see is that silencio is that in Alzheimer's disease, there is no actual compromise in musical appreciation, meaning that the patients are able to recognize musical stimulus independent of the rate of decline. The only way in practice that you will see that musical appreciation declines is when the patient is at a terminal state of dementia. And in this terminal state of dementia in practice, there is the fact that the behavioral disturbances will be minimum and the disorganized speech will be a minimum. So in these stages, it's not a very common motive of consult for the caregiver, apart of the need of more advanced support regarding basic activities like mobilizing the patient, feeding the patient, or even helping with its daily cleaning. Okay. Activation of the default mode network is heavily involved in memory preservation, and it's a target of musical therapeutic interventions. The default mode network is the basis of memory preservation and evocation. And in music therapy, our goal is to stimulate the patient for the activation of this default mode network. Okay. As a social work intervention, social decline is a common finding in dementia patients. Group-oriented music therapy enables the patient to engage in social activity, facilitates communication, experience sharing, and involvement of the primary care group in a positive experience, allowing the caretaker to interact with the patient in a symmetrical way. It's important to be aware of the roles of the patient in the family, of the caretaker in the care of that patient, and the relationships that have been developing in time before the patient consults the professional, because there are many instances where the previous relationship between the patient and its caretaker has not been a very positive experience and have been quite dysfunctional. This is not to say that it's a sine qua non scenario, but it's quite frequent. And in this, music therapy can become a very powerful tool to create scenarios for a positive interaction between the patient and his or her caretaker. Music therapy as an occupational therapy intervention can work to enhance physical well-being. If you couple musical stimulus with dancing, you can help the patient regain the sense of motor coordination, and also you involve him or her in a very active physical exercise, depending on the piece or the kind of musical stimulus or the dancing involved. Of course, improving motor coordination lowers the probability of the patient suffering from injury derived from a fall. And of course, musical interventions and dancing are based on rhythms and specific steps in order to properly perform in these activities. So you can train the patient through musical interventions in a purpose-oriented activity. Of course, which options do we have regarding music therapy? This is really complex, and this is a really vast area of work. So this is a very brief introduction of what can we do with the patients when we decide to work with them in musical therapy. And it's in group interventions, like in a daycare setting or a hospital setting, we can schedule group singing sessions. Of course, these ones require the patient to be a little bit more functional, and it's not recommended for those patients who have severe language impairment derived from Alzheimer's dementia. Musical discussion, it's a very interesting way to engage the patient in a social activity, but this works a lot better when the patient has a more prominent profile of behavioral disturbances, when his language is more preserved and his ability to interact with the environment is better. Going back to scheduled group singing sessions, this depends also from a cultural context, because group singing, it's more prominent in some cultures and requires the patient to have some preservation of memory regarding the lyrics of the songs, and actually can become a very important way to start a chronogram for a healthy lifestyle with the patient. In musical discussion, I sit with the patients, grab or select a specific piece of musical genre that hopefully is well known culturally and in the history of the patient, and start by playing it, if possible, having a patient to lead actually the singing or the playing of the piece, is if it's musically talented or has knowledge or experience playing an instrument relevant to the piece, and start discussing the finer details of the execution of that piece and relating it to the previous work of the composer and the previous work of the preliminary work of that specific piece. This is something that in Argentina it's getting a lot of traction, because tango is a very, very complex genre, and normally the pieces of tango have a very extends a very vast cultural influence and cultural background. Of course, group music playing, it's a very good way to interact and engage the patient in a physical way. As I said that in musical discussion, it was important for a patient with musical experience to lead the execution of the piece. In group music playing, this is also desirable, but as the goal of the group music playing is to actually have all the patients to engage in the playing or the execution of the piece, there are ways in which we can engage patients in group music playing without prior musical experience. For example, having a couple of drums or following the rhythm with your palms, it's a great way to engage in a group music playing. Now, there are individual interventions that actually benefit from having a provider sitting with the patient in music therapy regarding Alzheimer's disease. Facilitated singing, it's a great way to stimulate the semantic memory and to stimulate socializing in a one-on-one basis. Musical routine building actually relates to the daily chronogram of the patient. Musical stimulus in broad daylight helps patients to actually synchronize their circadian cycle. Of course, as you may know, one of the key complaints in dementia patients, even in the ones that are being treated properly, it's the nighttime activities, because they have a lot of problems going to sleep and frequently have a lot of difficulties getting up early. And in this, musical routine building can help them engage in activities from an early hour of the day, having them becoming more active throughout the day and facilitating that by stopping this musical stimulus in the evening or the night, we prepare those patients to lower their activities or to reconcile sleep earlier. Of course, one of the most important ways in which musical therapy can help our patients is in family interventions. To be honest, this is a preferred method in my consult, by using musical therapy to engage the caretaker in a positive way. It depends on the relationship between the caretaker and the patient. If it's, for example, the spouse of the patient, there is a high chance, it's highly likely that the musical pieces being selected are both known by the patient and his spouse. And by this, we can engage in musical therapy that involves experiences that are shared between both of them, the patient and caretaker. This is not quite applicable to those patients whose caretaker is, for example, grandchildren or the sibling or another person that is a lot younger than the patient with dementia. In which case, for example, musical discussion becomes more prominent when we have the patient explain his caretaker or her caretaker regarding the nature of the piece being played, Why is it important? What does he know or doesn't know about the composer or the author of the piece, and start talking about it. Also, to share his experiences or emotionally important moments of his or her life regarding that piece. Of course, this becomes important when planning a musical intervention. As you may know, it depends on the dynamic of the caretaker and the patient. The provider first priority is to know the history of the patient. And for this, it's important to interview the patient and the social network of his. Regarding individual preferences, of course, music is quite a vast universe with many options, and it's not a one size fits all. It's important to know what is the actual preference of the patient regarding musical taste. And of course, if we are dealing with memory evocation regarding its relation of specific events with musical pieces, we must know through the life of the patient which has been the changes in musical preference. This becomes more important as the cognitive decline, as the memory decline becomes more prominent. Of course, it's important to know which are the key moments of the life cycle with a deep emotional involvement. For example, a funeral where someone really important to the patient has perished, and in that funeral, if they specifically played a musical piece, it becomes really important for the patient, for the provider to know in which circumstances that piece was played, because invoking an emotional memory through music may invoke also the emotions related to it. And if we are trying or we are intending to invoke positive emotions, of course, we must prefer to select pieces that are involved or are related to positive experience. For example, the day the patient was married and they played a specific piece for them to have their first dance. Or in a funeral, when we are trying to intervene the patient to make him more conscious again of the death of a loved one, musical therapy can become very important in bringing back that emotional experience that was related to the funeral or the departing of a loved one. Of course, it's very important for this to have an understanding of musical preferences related to specific mood states. This is a real challenge in musical therapy in demented patients, because the caretaker not necessarily is knowledgeable about this specific fact. And if the patient has a specific taste when he has been happy throughout his life or her life and prefers some musical genres, for example, pop music, and we are trying to invoke those positive emotions through musical therapy, we must select that genre and preferably specific pieces to be played when we are talking with the patient. Of course, we have to know if the patient has any experience playing a musical instrument. If the patient, for example, doesn't know how to play the piano, but knows how to play the guitar, having him do the harmony or the rhythm of the piece being used for the intervention, it's a very valuable ability, because This allows the patient to be engaged more profoundly in the intervention. Of course, religious beliefs also become a part of musical therapy because, for example, if the patient is deeply religious and knows the individual gospels and they imply a heavy emotional background or a background of a routine like going to mass every weekend, this becomes very important in the engagement of the patient in musical therapy. And this is the patient I was willing to show you. This patient, this picture was taken with permission of the family. It's a patient currently 88 years old. His cognitive decline began at 71 years old when he started losing some capabilities regarding working memory. The complaint of his wife was that he was taking too long in the farm to do his job. His patient was a farmer throughout his whole life. When he started becoming older and the farm work was becoming more complicated for him, his siblings decided to move him and his wife to the city. In fact, this was counterproductive since the patient from that point onward developed a temporospatial disorientation that was becoming more and more profound by the day. This patient was really challenging to treat because he was becoming rather hostile and in his disorientation began frequently attending the police station to charge a brother for a theft. This brother had died 40 years prior of the time when this behavior started appearing. In one of my home visits to this patient, I found out that in a specific time of the week, there was a musical program being showed on TV. Serenata was its name, and it featured boleros. Bolero is a musical genre that it's very popular in the older population here in Colombia, and features pieces that sing about mainly love and tradition and farm work as well. So this was a perfect match for this patient's history. A deeply religious patient also participated in mass several times throughout the day, every day. He still does at this time. But what I found out when this patient was listening to this TV show was that this patient started singing. His mood greatly improved. He was really happy with what he was listening, and he started telling his daughter, which he no longer recognized, about this specific piece and how this was played when he went with his brother to do some errand that involved a very positive experience. Of course, I extended my visit that night, and I noticed that this patient, that the positive mood developed by this experience lasted for quite a couple of hours, something that was not possible with medication and interventions alone. Also, well, since this kind of music was also known and enjoyed by his wife, the interaction between them became that moment quite amicable. And that started my interest for musical interventions in patients with dementia, being right now a key element of the daily containment of his psychological disturbances and his behavioral disruptions. Of course, Last but not least, musical therapy, it's a great complement for dementia treatment. It's not meant to replace proper interventions. This model of intervention, it's not exclusive, and it does not preclude the pharmacological interventions to the periodic controls, psychotherapy for the caregiver, and support for the social network. And of course, be mindful of the limitations of the patient. Remember that demented patients become intolerant of overstimulation, of loud noises, and of course of long activities that demand long-standing attention capabilities. So of course, given these limitations, there will be moments when the patient is not able to perform the musical stimulation for the time that it was originally planned. Be respectful of the beliefs and preferences of the patient. Of course, if you are attending an elderly patient, you must be aware that his values are different from yours as a provider. Of course, this is more important as the age gap between the provider and the patient becomes bigger. Be informed regarding the musical pieces that you will use in your intervention. The socio-cultural context of the pieces is vital in their interaction with the patient during the sessions. This means, please, there will be pieces that imply a very undesirable mood states. And this is the duty of the provider to be aware of which ones are not to be used for their emotional makeup. And having said this, I want to thank you all for your attention. These are the ways you can contact me. And of course, thanks to Rainer for this event. Thanks to all the team of the Global Psychiatric Association for turning this event into a reality. And of course, for the spectators of this presentation, make sure to join the Global Psychiatric Association at this address. Thank you all.
Right. I think it's a great talk, and I'm very pleased we didn't just present you a video. I think there was just mention from, I don't know, so there's a mention from Daria from Iraq that they're working on music therapy and have good papers on that. The other thing is, I don't know, just there was Daria Smirnova said, you know, I just know whether you want to comment on that, you know, your tango expertise. I can just a quick thing. I just was doing some teaching of, I was